Hello and welcome to Our Time. Thank you for joining us.
Yeah, thank you. I'm glad you came.
No.
Could you just keep it down a bit though, just?
Oh, on the program today, Sue's coming to talk to Christine Veldy. But I think, do I need to get you something?
Doctor, I've got a headache.
Well, fortunately, we do have a doctor in the house. Dr. Ray Cass is here. Welcome to the program,
Pleased
Doctor.
to be here.
Can you fix a headache, Dr. Ray?
I can certainly try.
Can you? Fantastic, I feel better already. Is that what people do, present with headaches when they come into your rooms?
Well, headaches are very common presentations. So at any one time in Australia right now, 15% of the population would have had some sort of over-counter medication for headache.
Okay. I haven't got one, just by the way. I was just acting.
Very well too, I might
thank
say.
you very much.
So there's been an intense interest in headache over the past 5 to 10 years because it's clear that there's a number of conditions that are poorly treated. So we're mainly talking about migraine when we talk about conditions that are not well treated. So, you know, perhaps 10% of the population has migraine. So that's a lot of people. There's 23 million people.
And a migraine, not that I've ever had one, touch wood, but is really debilitating because you cannot function, can you? It is something
That's right. So the typical migraine would be a throbbing headache associated with nausea, and it's extremely common.
Is it like in the front of the head, the back of the head, the side, or just all over?
Can be all of those things. But it tends to characteristically be throbbing associated with nausea, and the patient typically has a sensitivity to light and to sound. But you can also get stroke-like symptoms with migraine, which is not well known about.
Is that with the arm? Or
you can get paralysis of an arm or difficulty with speech. And you can even have those symptoms without any headache at all.
Right.
So, you know, a migraine is basically a spasm of a vessel that constricts. So then you can get a stroke-like episode.
Oh, okay.
And then dilates and you get the headache.
That's the first time I've ever heard that.
No, me too.
Because the next question...
extremely common.
Well, the next question I was about to ask you was, what defines a migraine?
Well, those are the International Headache Society guidelines for diagnosing a headache.
Right.
So it's a clinical diagnosis. There isn't a test or an investigation I can do to diagnose it. It's just based on the history. And so, you know, over the last few years, there's been an intense interest in headache because it's been clear that we, as a medical profession, we've been quite poor at treating them. So, you know, my patient that comes into my rooms is typically a 40-year-old woman. She would have had headaches from 10 to 20 years and has had no treatment. So an average patient with migraine goes to see a medical health professional. The likelihood that that person's going to get any treatment is extremely low. It's probably about 5%. If you're lucky. So
would it be more like take 2 aspirin and see me in the morning type thing, the old gag?
Yeah. Look, there's lots of reasons about why it's been undertreated. It's part of it's undereducation of the medical profession. Some of it's the patient themselves. They believe that headache is normal.
Is there a pain threshold that comes into that as well?
Up to a point. But
if I've always had a sore head, I just think that's normal?
That's right. So it's very hard to convince them that headache isn't normal.
Right.
They believe it's stress, sleep deprivation, illness. It's just who I am.
Yep.
Women get headaches.
Yep.
So it's actually quite hard to explain to them that headache isn't actually normal.
But is it more, you're saying that women get headaches, but are as many men get headaches as women?
No. So if you look at migraine, the ratio of women to men is 3 to 1, and in my rooms, I think it's higher than that. It's probably 8 or 9 to 1. So I don't commonly treat men. It's mainly women.
Mostly women.
Yeah.
They come to you because you're good looking.
I can't comment on that.
See the smile, see the smile. Now, if you had a doctor sitting across like that and you had a problem, I'm sure you'd make them feel better to start with.
That's right.
Is
in
care,
a gentle manner.
Yes, but is that part of the doctoring, if you like, to people?
Yeah, look.
To make them, because you've got a nice demeanour, to sort of help them through and help them understand?
Well, a lot of them have gone for medical help and been rejected. It's just a headache. Put up with it.
Go to bed.
It's who you are. Go to bed. You're anxious. You're depressed. So, you know, my role is to validate their symptoms. It's not hard to validate it. Their symptoms are quite bad. And to show them that there are treatments available, that it's not all hopeless. I mean, I think part of the reason that the medical profession hasn't helped because they thought they couldn't. So they get them to...
Just because of a lack of understanding of the brain function, is it?
And also because there wasn't a whole lot of available treatments. So it was felt for a long time that headache couldn't be treated. But there's been a big increase in the interest in headaches. So, for instance, in the United States, 10 years ago there was 5 headache centres and now there's 55.
Wow.
So it's a big deal.
Right, you can understand that with the Americans with their political situation, but...
Yes, that might cause headache for anybody.
However, so let's just go through this. At what point of time does somebody really come to see you? Is it, oh, I'm just not feeling, you know, I've got a bit of a headache, I'm just not feeling 100% right, I think I need to see somebody? Do they go to a GP first who would...
Yeah, so they would go to a general practitioner first, and then hopefully the general practitioner would refer on if the symptoms are severe and chronic.
Yep.
But the first hurdle is actually at the referral stage.
So if somebody is going to a GP and you're just not really getting the information that you want from the GP, is it wise to try another GP? Like they're just saying, you know, here, take these whatever pills
I find that the GPs who are best with managing migraine and headache are the ones who've got migraine themselves.
Okay.
And they understand what the patient...
Go to a female doctor then, is that what you recommend?
Well, that's kind of true.
It's a good point though, when you think about it, isn't it? It's just, everybody's a human being and we all need to be comfortable with the people that are giving us advice.
Look, I don't think that they're necessarily rejecting for any... They just don't know, or they just don't understand migraine. You can't blame them if they've never been educated about it.
No, awful lot to understand in a human body though, isn't
That's
there,
right.
to be a GP?
That's right, but it's really common though, so they're missing out a big chunk of medicine, aren't they?
So well, we've talked about the pain that you can have, but what about things like loss of vision because of a bad headache and the other symptoms that you can get?
So those would be the stroke-like symptoms that I talked about. So, you know, I've got some patients who get quite severe, multiple types of stroke-like symptoms. I've got a young woman who doesn't get that much headache, but she can get 3 or 4 stroke-like symptoms inside a day. So they know what it's like to feel like having a stroke, but they recover.
Wow, that's...
And you can actually have a stroke from migraine also.
You can?
A completed stroke, yes.
Right. Well, not to frighten anybody, but it gets back to that same thing. If you've got an issue, go see your GP. If you're not getting any better, maybe try another one for a second opinion.
I think so.
And maybe ask to see a specialist who really knows what they're talking about.
Yeah, so there is quite a lot of resistance about that. There is an outside perception about headache. So I've got a patient who saw that botulinum toxin was going to be used for chronic migraine, and his GP said, I'll show you what you really need. And he looked down and wrote a note and he said, what's this? And he said, it's a referral to a psychiatrist.
Okay, not quite the answer, is it?
Not quite the answer he was looking for.
But you just mentioned this new treatment. Oh, sorry, were you going to say that?
No, I was.
Oh,
yeah,
there you go.
good.
See, I was reading your mind. We're connected. Hold my hand, quick.
Very good.
So, but Botox has been known to help patients with
Yeah,
severe
so...
Well, the brain's a wrinkly thing.
It is. Well, that's a separate issue. That's a separate issue.
Not quite the same.
So botulinum toxin was released on the PBS 2 years ago in Australia, and that's around the world as well, because there was a trial that showed if you had patients with chronic migraine who'd come to the end of the road, so all the medications had failed, there was nothing else they could do, botulinum toxin in about 70% of people probably brought down a 50% reduction of headache. So if you're talking about an end-of-the-road treatment where everything has failed, those are astounding numbers.
Well, how do you administer that?
So they get injected around the peripheral nerves around the scalp. So there's 5 nerves that we inject on either side.
Where? Show us on Janice. Where?
I can show it on myself.
Oh, okay, you can do that too.
So there's 2 nerves here.
Yep.
There's 1 here.
Yep.
And there's 2 at the back. And we inject on either side of the nerves.
Right.
It's done with a diabetic needle. It's not a painful
So it's very fine,
procedure.
very fine needle. Yep.
And the idea, people believe that botulinum toxin relaxes the muscles around the head. But in fact, the idea is that you block a hormone that the nerves excrete called substance P, which is P for pain. And so botulinum toxin blocks that, and then the brain sees that there's not enough substance P being produced, and then it reduces it in the brain. And it's a very effective treatment. None of us believe that the trial was correct. We think it's much better than that. So we don't think it's 70%. I wouldn't quote that number because I don't believe it's true.
Okay.
And I think all the people that use botulinum toxin don't believe the trial. And I think, trials aren't real life. They don't test, the patient's well-being or are they depressed because they get migraine? Does that improve? All those kind of factors that we see in real life.
Do migraines make you depressed? I mean,
they're certainly associated with a high incidence of depression and even suicide.
If you have them often enough, I would think you'd...
You're talking about
Which
patients who would get a migraine 15 to 20 times a month. So
Right.
I've got patients who've had migraine every day of their lives.
Whoa.
what a difficult way to live.
Whoa.
Yeah, well, we're
But
talking...
that's all they know then.
That's all they know. That's all they know.
So without sort of sounding too negative with this, there is treatment though that can assist.
Yes, so botulinum toxin's probably been the most effective.
The most effective, as opposed to take a pill, a
Yes.
painkiller.
Yes,
Yeah.
I was
yes.
just thinking, does it help with the wrinkles as well, though? At the same time.
I do get asked that question a lot. So
Look at his face. Look at he
The,
knows where to put those little
Yeah.
injections.
the ladies get interested in that. Yeah. And some of the men.
Okay.
On a daily basis, you obviously see quite a lot of patients with issues.
Sure.
How does that affect you as a specialist in this area?
Look, I believe that I have a duty to give them effective care. So I actually get a big kick out of it because if you've seen a patient who's had 20 years of headache,
Yep.
and then you treat them,
Yep.
and they get improved. So I've improved some people to 0 headache inside 1 injection.
Brilliant.
So you get marriage proposals, you get these kind of things.
But it's a
and
positive thing too.
Absolutely.
So that positivity can go both ways.
Well, they just didn't realise that anything could be done. So you change them, and they find that their lives change. Like a lot of them are chronically unwell, so their houses aren't very clean because they're too tired and too unwell to do it.
Good point.
And they find, all of them tell me their houses are cleaner. And they do things,
That's
and they
brilliant.
go, "What are you doing?" And I go, "Oh, well, I'm cleaning the house." And they go, "Oh, well, you don't normally do that." So they go off and do hobbies and all sorts of things, all that sort of thing that you can't measure in a trial. So they're very.
There's so much more we would like to talk to you about. Would you
Sure.
come back another time and
Be
can we
delighted
talk
to.
about some other subjects in this area?
Any neurological
Great to
topic
know
is fine.
about that, but I'm sure there's so much more we can find out. Dr. Ray, thank you so
Yeah,
much
it's
for
been
being on
fascinating.
Our Time.
Pleasure.
And we'll be back very soon with Sue with Christine Veldy.
As those of you who watch Our Time regularly will know, I love reading. It's something that fascinates me, always has throughout my life. And I've come across a couple of books. One's called Shanghai Rumours, The An Expatriate's Journey to China and Beyond, and another one called Dragonflies by an author who I have just discovered actually went to the same school as I did, which we've just been having a little chat about, which is amazing. Dr. Christine Veldy, thank you for coming in today and welcome to Our Time.
Thank you, Sue.
Now, we started to talk about your journey, how you became a very well-educated woman yourself and worked as an educator, but then a researcher and a writer. And I wanted to find out how you came to write these books, which was the way we came to work out that we'd actually gone to school together, which I think is incredible in a place like Australia that happened. Anyway, your journey, you started here in South Australia, in Adelaide, as a student. You moved on then and did a diploma of teaching, as I did, and became Bachelor of Education. How did you get this journey, the journey that took you to Shanghai?
Okay, I went on a bit further in terms of study as a mature age student. So I left school very young, I was 15, and I went back to study after having my 2 sons. And through my work, I became interested in working in an Asian country. And I applied for a job in Shanghai as academic director of a design college.
Now, this is a mature age student, so your boys had grown up,
Yes,
I gather,
that's
by this
right,
stage?
they had,
Right,
yes.
yes.
Yes, so it was quite hard work, raising 2 children and also studying, and but that's what I wanted to do, so yes. So.
And the move for you to go to China, to Shanghai, that's a brave thing to do.
Yes.
Did you take your children with you at that stage? Well,
no.
They were grown up.
Yes.
Yes. Okay.
No, it was a brave move. They were grown up then. I have tended to take risks in my life.
Yes.
That was one of them.
Yes.
And I loved it while I was there. The job was very challenging.
Yes, you applied for a position in Shanghai.
Yes.
And what was that position?
I was academic director of Raffles Design College in
Right.
Shanghai, China.
Yes.
And it had sites across Beijing, Shanghai and China. I was based in Shanghai, and I introduced a lot of new programs there, and I didn't teach. I oversaw the quality of the teaching.
Yes.
And through that experience, I became very attached to the place as well. So I actually renovated an apartment there.
Wow.
And
did you
lived
learn-
there for about 4 or 5 years.
Right. Did you learn much of the language?
I started to, but work took over. So,
You often hear this. You know, people say when they go to a place like China to work, they don't actually learn the language because they're speaking English all the time.
Yes.
Chinese want to learn English, so that's what happens.
yes, well, I worked. The school I worked for, it was Singaporean owned. So basically, the people that worked there spoke English. So I got around learning. I got around with basic Chinese,
Yes.
taxi Chinese, we used
Yes,
to call it. So.
yes.
So I was able to get around very well.
Christine, this book, Shanghai Rumours, An Expatriate's Journey to China and Beyond, how would you describe it to people?
The book's a memoir, and it consists of my own experiences and journey to Shanghai, China, and also those of other expatriates. I interviewed expatriates in Shanghai in 2012, 11 of them, and I felt that by including their experiences, the book would be more objective than just my own story. So I've interwoven both.
Yes.
It's also beautifully illustrated, I think. The publisher did a good job. And I took all the photographs, and there's about 60 or so within the book.
Yeah.
And they depict the daily life of Shanghai, and some of them are historical photos. It's based on research, so it's quite literary in style as well. So,
What are some of the challenges? What are the main challenges that expatriates encounter when they move to a culture like China?
I think the language is a barrier to begin with. The size of the city. I mean, it's a city of 20 million people, and
So we have little concept of that.
yes,
20 million people.
Yes,
is
so
just-
that's what you notice when you first go to Shanghai.
Yes,
There's just
yes,
traffic
yes.
everywhere, and the scale of it's quite amazing.
You said you've got a couple of, perhaps I can give this to
All
you to
right.
read, a couple of challenges that you were of note.
Okay, these were just a couple of challenges, and that I noted, and which reflect what it was like to actually live there. So the first one, I go out to have dinner at a local restaurant. I come home and a security guard is sitting on a chair inside my apartment, and 2 others are sitting outside. They are all dressed in military-style uniforms. My heart pounds in my chest and my stomach churns. Using halting Mandarin, many hand gestures, and a Chinese-English dictionary, it seems that I left the door open by mistake, and they are trying to look after my apartment for me.
That's outstanding.
Yes,
Incredible.
yes. They were the Chinese very welcoming and very, very caring in that way.
Yes, lovely.
And when I first arrived in Shanghai, I wrote in my journal, I find it so hard to try to communicate problems to an owner who cannot talk to me, agents, security guards, etc. so draining that I get sick with sinusitis from running out in the middle of the night to get help when all the power goes out. Sheer frustration. It is freezing cold, so I wash my hair in the hand basin, which probably makes me sick. I'm dying for a decent shower. My toenails look sick. My skin is drying out with the cold air.
Wow, it's very cold winters.
Yes, below zero.
Okay,
And
well,
snowing.
it looks like a fascinating read. To imagine, I mean, I know there are more and more people increasingly moving to Asian countries,
Yes.
aren't they, for work?
Yes, there are.
Globally, people's careers take them on the global scene, don't they? And the internet's facilitated that in many ways.
Yes, that's true. That's correct. But I think there are still few people, I think, that don't take the risk. That I think you learn a lot from living in another
experience of
country.
living there.
And it's quite transformative. There's many challenges.
Yes.
And I think a lot of people talk about it. There's still a lot of people who don't do it.
No, I think it's very brave. The second book, Dragonflies, a prominent expatriates' influential roles in Indonesia. What time was there gap between the first book and this one?
It was probably about 12 months.
12 months?
Yes.
And did you spend time living in Indonesia, or was it a case of you going over there and interviewing people?
I actually went over there on holiday initially, and I liked it, and I liked the culture. So went back a few times, and I went to a writers' festival in Bali, and I was approached by a publisher, Grand Media Publishers in Jakarta, and they said that they would like a book to be written about Indonesianists, so prominent expatriates in Indonesia.
Yes.
And they, so the senior editor that I spoke to, we corresponded by email, and then eventually we came up with this book, and it was actually presented at the World Book Fair in Frankfurt in Germany last year. I interviewed, his brief to me was to go and find Indonesianists and find those who have strong connections with Indonesia, who still have strong intimacies with it. So I went looking for them initially in academic departments and universities, but I found that there were Indonesianists in government departments, in all walks of life. And so I interviewed 14, and there were two in particular I could mention, if you like, as examples.
Yep.
One is Arie Schmidt, who is a famous Dutch painter. He was a prisoner of war, and he has many paintings in the Nika Art Gallery in Ubud in Bali. So his experiences, having been a prisoner of war and being a great artist, actually fascinated me.
Would have been wonderful to talk to people like
he
that.
was, yes. And he's 100 years old coming in April.
Wow. Yes, I was just looking at his painting in the book. And the challenges faced by people in Indonesia, is similar to China?
Similar, yes, similar. Indonesia, like China, had the Cultural Revolution and quite a traumatic past. Indonesia has had a traumatic past in terms of various revolutions and coups and so on. So I found that the expatriates I interviewed, they still stayed there. You know, they still had that attachment to Indonesia, that they would return.
Sure.
They either lived there or they'd come back to Australia and they'd return there.
And they return. Well, at
Yes.
least Indonesia's closer.
Yes, that's right.
They're fascinating books, fascinating. And I think if anybody is looking at either doing an exchange program in any way through schools or working, these would be excellent books to read, to have a
Yes.
sense of what it's like to live in another country like that.
Yes.
Thank you so much for coming in. It's been a
Yes.
very interesting session. And I recommend people have a little look for these books. Shanghai Rumours, An Expatriate's Journey to China and Beyond, and Dragonflies, Prominent Expatriates' Influential Roles in Indonesia. Thank you, Christine. Sorry.
Thank you. I was just going to say they're both available at Dymocks.
Dymocks, okay. Yep.
in the city, in Rundle Mall,
Wonderful.
and on Amazon.com.
Wonderful.
So if anyone
Fabulous.
wants to look them up,
All
they
right.
can do
Thank you
that.
so much for coming in, and all the very best.
Thank you very much, Sue.
great to have you on the show again.
Great to be on the show.
You look different too.
Oh, yeah, had a chop, bit of a chop. I did.
Yes,
Yeah,
looks lovely.
Fascinating talking to Christine. Fascinating, and I started to talk to her about her journey and how she ended up in Shanghai. And she says we started schools and went to the same school. Can you believe
went to
that?
the same school.
Same
Isn't that
school,
amazing?
Brighton High School. Can't believe that.
Incredible.
I know.
And also learning
Small
more
world.
about headaches.
Oh yes.
And migraines.
Yeah.
I've been lucky, never had that. Have you?
No, I haven't.
Oh, I
fortunately,
have. Horrible,
you?
Horrible,
We
debilitating.
know a doctor you can see.
I heard, but I've actually got them under control. But yes, it wipes you out completely.
Well, we would love to hear from you. Don't forget to contact us at this address. So until next time on Our Time.
Bye for now.
Bye.
Bye.